Johnson & Johnson and the Mission for Essential Drug Supplies, MEDS, are value-based organizations that believe in impacting communities where they work and live. MEDS was established in 1986 as a joint partnership of the Catholic Church and Protestant churches in Kenya through their respective health secretariats, that is, the Kenya Episcopal Conference and the Christian Health Association of Kenya. Johnson & Johnson believes a corporation has responsibilities to the world community, whereas MEDS, though faith-based, goes beyond religious barriers to serve those with the greatest need. Since 2004, Johnson & Johnson has partnered with MEDS to offer miconazole mucoadhesive buccal tablets for oral thrush at the lowest possible cost to people in need in Kenya. Miconazole MAT is manufactured by Tibotec, a Johnson & Johnson company. This relationship has expanded to include training of healthcare workers, provision of highly subsidized home-based care kits, strengthening of quality control at MEDS, and community grant making.
MEDS offers quite a wide range of services, but the core ones being the procurement, distribution of medicines and medical supplies, and we also deal with training of the clinicians and people working in the health facilities in the proper utilization of these medicines and management of the health facilities.
MEDS is a very unique organization. First of all, the mission that has formed it, and the fact that it is almost like a community-owned organization with a mission to provide low-cost, quality pharmaceutical supplies, especially to the underserved within the society.
MEDS has encountered challenges within its operations, the major one being the quality of medicines which we get within the country. With the liberalization of trade within the country, that means medicines can come from any part of the world. We've even of late started seeing counterfeits coming into Kenya, and as we test, we realize that we have to invest more money within our quality control laboratory to be able to counter the quality of medicines within the country. We had to accelerate the process of getting WHO pre-qualification so that we'll be able to act as a watchdog within the region for quality assurance of medicines. You may realize that MEDS Quality Control Laboratory is one of the 4 within Sub-Saharan Africa which has gotten WHO pre-qualification, and that gives it a strong voice to be able to fight against counterfeit and partner with the governments in the same.
In 2004, the Miconazole MAT award ceremony was launched, where 6 community-based HIV/AIDS programs were given cash awards. Since then, the function has become an annual event, and to date, over 128 community-based HIV/AIDS programs in Kenya have been given grants to support their work at the grassroots. The awards ceremony is held at the beginning of December to coincide with the World AIDS Day under the banner "Partnering with You to Support HIV/AIDS Patients." The work of the community groups you are about to see would not be possible without the services of MEDS to provide safe, high-quality medical supplies at the lowest possible cost. Nyumbani Children's Home is a home for HIV/AIDS children, most of them abandoned by their families and caregivers. This home responds to the plight of pediatric HIV/AIDS patients in terms of stigma, prolonged use of antiretroviral therapy ART, as well as unavailability of some of the critical drugs required for pediatric ART.
The home here, which is residential, have accommodation and all that's necessary for living in a home. For the children Leototo, we support them with education, and also we train their caregivers. When we started, we were a hospice. We wanted to reach out to these children in compassion, to give them quality life for the short period that would be theirs, because we didn't have access to any antiretroviral medication. When we got access here in Nyumbani Home and in Leototo, the children now can live a full life and dream their dreams for the future and not think in terms of the fact that their life may be cut short.
The ASN Upendo Center is located in Naivasha town, where many people work in the thriving multi-million-dollar flower industry. This center helps highlight the impact of broken families as more and more people take up jobs in the flower farms, leaving behind their families. ASN Upendo, however, gives a ray of hope by economically empowering the HIV/AIDS patients through their Alpine Goat project. Each recipient of a goat is expected to surrender the firstborn she-goat back to the program to be awarded to another patient. Over time, there are many recipients whose lives have since been transformed, but there are an equally large number of patients still in the waiting list.
This is a project that has started sustaining itself because from the first recipients, they have given back 10 kids, which have gone to 10 more families. And they have already started getting goats for the family. So the project now, it's buying actually from the first recipient, and the program is only about 2 years, so this is the 3rd year into the project. Our intention is to empower families to generate their own income so that eventually they can become self-reliant, and then we win dependency.
Ngireherwo mburi ino murona haha. Mburi iyo ngianjia igithii uguo igiciara kori gaka murona. Mburi iyo ni ikoretwo ikihe iria ria mbia nyingi muno itangihota kwigurira, ngakorwo nginywa iria ni na ciana ciakwa, ngakorwo ngithii uguo ngakorwo ikihe thumu wa guita mugunda haria turakihanda ona nyeni. Koguo nie ni nyonete magegania manene kwi Upendo ni tondu ndie ndarekio nio.
Since we got registered, we have been purchasing quality medication, quality supplies, because we value with meds is that they have quality control. So whatever we are buying from there, we know it's of high quality and it is also affordable.
The Pandipieri Community Health Project is located in Kisumu town in the Nyanza province of Kenya. Nyanza province has the highest HIV prevalence rates in the country. The Pandipieri Community Program has greatly impacted on the lives of HIV/AIDS patients by helping reduce stigma as well as helping orphaned children manage grief by introducing memory books. The memory books are prepared by parents, mostly on their deathbeds, who document family history, their aspirations for their children. The memory books are handed over to the children when the parents pass on, and this helps them manage grief better and also gives them identity, as most of the children find themselves in unfamiliar settings with the death of their parents. Children also maintain these memory books to record their life experiences, fears, and hopes.
Nyaka ndigo bugja rapar ni osakonya gi ng'eyo chal mara, osakonya gi riwruok gi jowetena kanyakla Pandipieri. Osakonya miya bedo matek, kendo osakonya miya ng'eyo chal mar mamana gi babana.
The memory book was able to open ways for these children to discuss with their parents or their guardians as they are ailing, so that they have something to know from where they originated from, who are people back at home, and so they can trace their family contacts back at home. There was disclosure, environment of discussing HIV between guardians, parents, and their children. And this opened a very good support for us to come in and discuss about HIV.
We have won the Meds Award 3 times since 2006. And in 2006, it enabled us to do something we wanted to do for a long time. And that was to do maternal and child health. And through Meds, they bought us a KP fridge, and now we can deliver very good services for maternal and child health.
Nomadic Trust is located in Samburu district of northern Kenya. This area is inhabited by nomadic communities, thus making access to treatment difficult. Nomadic Trust has come up with an innovative and cost-effective camel transport model. This model allows them to use minimal resources to traverse the rough terrain of northern Kenya. They walk over 250 kilometers in 30 days to distribute medicine to those in need.
I experienced many things because when we went there to the interiors where people didn't see camels, there are others who followed us because they have never seen camels. There are those who had never seen medicines, they don't know medicines, but we introduced them to medicines. There are those who didn't know about the family planning. You see, many families had more than 10 children. We introduced them to family planning methods and they were very happy. Others didn't know their status, and we tried to tell them the importance of being tested and knowing their status, and they agreed, and we tested them.
Kufunza ngamia kubeba, kuweka vitu masanduku, naweka madawa na mattress na mahema na kila kitu. Tunaenda safari sasa. Asubuhi tunaondoka kama saa 10, tunaondoka tena kama mpaka pale nyingine hata hakuna watu. Tunapaka pale watu iko nasaidia watu madawa.
The impact of med services to the clinic, before we didn't have a source. It was very expensive to buy drugs from nearest pharmacies. We didn't have a system, a strong system. But one of our staff was working elsewhere, came and introduced us to meds. And we were very happy because we are able now to buy it back. It is cheaper. Buying drugs from meds is cheaper. We get quality drugs. We get all drugs, in fact, that's the order from meds.
We have 23 support groups on ground of people living with HIV. But we link these people to CC cares because I cannot over the ARVs because we have shortage of staffs.
We didn't have money to buy drugs. In fact, we are almost completely with no money left to buy the drugs because we get the money from the donors. So that money boosted us to buy nutritional supplements for the clients, to buy drugs in our stores. Yeah, and the drugs still we are using.
For us, there is nothing great like helping a mother or a father to be there for their child, even for the next 5-10 years. For me, that is a success. Giving them a lease of life through support so that they can be around for their children.
Words are inadequate to express our gratitude to Johnson & Johnson for their continued support of Nyabani in its programs right back over the years.
I see children who are healthy and living longer and enjoying good health for a long time. 10 years ago, you would be talking about 3 or 5 children in the nursing room, very sick. But now, we literally don't have anybody in the nursing room. All the children who need to go to school are going to school.
Previously, like in 1998, people were dying, really, really dying. And because we now can look at the patient support service, people are living, children have their parents. And that, I think, is what we want to say to Johnson & Johnson and to the government of Kenya, is to please continue to support so that we can support those most in need and that children remain with their parents.